Good evening, friends. I am Dr B S Mhadeshwar from Kankoli. Today I am going to discuss about the use of insulin in diabetes mellitus patient. Actually, before we discuss in detail about this insulin secretion, we should know the physiology of insulin secretion. So whenever we take food, there is a rise in blood glucose level, and this raised blood glucose stimulates GLUT2 receptors on the beta cells, and there is an entry of the glucose in the beta cell, and there is a release of already stored insulin, and this is called as first phase insulin secretion defect. Similarly, when we take food, there is a stimulation of cells in the GI tract. They are called as K cells and L cells, which secretes incretin hormone, and this incretin hormones they stimulates beta cell for the release of insulin, and this is called as second phase of insulin secretion. So if the beta cells, if they are not at all there, then this insulin secretion, even the blood sugar is high, insulin synthesis or secretion will not be there at all. So there are some patients we will get such type of problem where the beta cells they are not at all there, and this is seen generally in a juvenile diabetes where the patient's age is less than 12 years, and this is always autoimmune disease where the beta cell total destruction is there, and this patient will need definitely lifelong insulin. So there is no any reversal of diabetes in such type of patient. Similarly, there are some patient which is called as LADA, latent autoimmune diabetes of adult age. Similarly, lady, latent autoimmune diabetes of young age. So in these two conditions, these are also autoimmune disorders, and there is also total absence of insulin because of no beta cells. So these three conditions, juvenile diabetes, then LADA and lady, will need lifelong insulin from outside. So because the beta cells from your own body they are not there, so no synthesis of insulin at all. There are some patients where there is an infection or injury or some damage to the pancreatic beta cell, maybe because of toxin or maybe because of infection, where the insulin secretion is also very less, or sometimes it may not be there. So this is called as pancreatitis. Similarly, there is something called as diffuse pancreatic calcification, where the beta cells they are not there, and this condition also will be, it is just like type 1 diabetes where the beta cells they are not at all there, and these two conditions can be there with any patient any time. Pancreatic calcification will be definitely without synthesis of insulin at all. So these again conditions where no oral drug will take any benefit. It is useless giving such patient any oral anti-diabetic drugs. So for diagnosis of these two conditions, we should take history properly and necessary investigation. Then only we can prove that this patient they have got no insulin at all, and this patient again they will need lifelong insulin. And again in this case, in these two types of patient, no reversal of diabetes at all. Now there are some other patients where, especially type 2 diabetes, where the patient is diabetic for more than 10 or 15 years, and this patient they are given very strong doses of beta cell stimulant, sulfonylurea or any other drug, and if there is damage to the beta cell because of excess use of sulfonylurea, then again this patient might need insulin in addition to oral antidiabetic drugs. So it is not firm that always type 2 diabetes is only orally antidiabetic drugs and no insulin. It is not so. So this patient might need insulin at later stage to prevent the complications of diabetes, especially because of hyperglycemia. So there are some other patients where the insulin may be needed for a short period. For example, suppose a person has got very high blood sugar initially diagnosed for the first time because of wrong eating habit or because of some excessive eating, especially very sweets of high glycemic index.